Well, good afternoon, and thank you for joining us again online. I want to thank Wyoming PBS for broadcasting this briefing live around the state on television, YouTube, and Facebook. Joining me today is Superintendent Balow, Dr. Alexia Harrist, and Director Lynn of Homeland Security. Let me make it clear at the start that Wyoming is deploying every asset we have to combat this crisis of COVID-19 and the crisis that it presents to the state. Moreover, I want to emphasize the point we are all making, whether it be Dr. Wheeler with the Wyoming Medical Society, whom I invited last week, knowing full well what the Wyoming Medical Society had said in their press release, whether it be Dr. Dowell, who spoke today in today's paper, whether it be the Natrona County Medical Society, which supports how the state is approaching this crisis, we are all saying one thing: stay home, wash your hands, maintain 6 feet of distance between yourselves, only go to the store as an individual, not as a group. Do not congregate in groups of more than 10, and if you are a store, for heaven's sake, don't allow shoppers to mingle in the aisles or checkout lines. Now that is the behavior we need. That is why we agree, and it is critical that we behave this way. Let me say it again. Stay home. Practice extra hygiene, practice social distancing by maintaining at least 6 feet between yourselves. Don't mob stores or allow your kids to gather up for play dates. So this week's message, the one that you read early this week, and Governor Gordon has not issued a shelter-in-place order. And I want to know how that is helpful to the message of stay home, practice extra hygiene, practice social distancing by maintaining at least 6 feet between yourselves, don't mob stores, or allow your kids to gather up for play dates. I'm not really sure, but it makes for a good headline, I suppose. And what would the next headline be? My guess it might be the one that ran yesterday. Industry, classify workers as essential. So what is that? Stay-at-home order. Well, here's Colorado's. Colorado's has multiple pages of exemptions. So the story would be, what's an exempted business? Here's Larimer County's. Multiple pages. Here's a letter I got today from the Society of Professional Journalists. Journalists are essential to reporting on our communities, many of which are rural and rely largely on information disseminated by their local papers and stations. Absolutely true. While much reporting can be done from home offices and on home phones, journalists, particularly photographers and videographers, do need the ability to verify and document events on the ground. No argument, but most of you are on a phone today. And all of that's based on something that people are calling CISA guidance from the federal government. Again, multiple pages. What we did was we said, stay home, wash your hands, maintain social distancing. Don't go to the store unless you have to. Do that in short groups. And that's what we did. That is essentially what a stay-at-home order is. And if you're waiting for me to issue a shelter-in-place order, when you have Dr. Wheeler and Dr. Dowell telling you that you should stay home, and I'm telling you to stay home, what are you waiting for? Are you waiting for Mother May I? Or are you taking care of yourself and practicing the common sense that we expect? One of our Wyoming values is talk less and say more. Our orders talk less and say more. So thank you for that. Now I want to say, since I last spoke to you a few days ago, conditions around the state and around the country continue to change. As I announced about 90 minutes ago in consultation with Dr. Harrist, we are extending the existing public health orders we have in place through the end of the month to April 30th. This aligns Wyoming with President Trump's recommendations. And I want to reemphasize a point that I continue to make. As a state, we should be all committed to the same thing right now: staying home and avoiding gatherings. We must focus on improving compliance and adherence. This depends on people taking this seriously and doing the right thing. That's how we protect lives. That's how you protect lives. The lives of our citizens, the lives of our healthcare workers, the lives of our children, the lives of our grandparents and vulnerable people. To reiterate, a stay-at-home or shelter-in-place order with large numbers of exemptions will not provide additional public health protections beyond the statewide orders we currently have in place. We have adjusted one of our orders slightly with regards to restaurants. Under the extended orders, restaurants will only be permitted to provide curbside carry-out delivery. Customers will no longer be allowed to enter restaurants. The decision to extend these orders is not an easy one. I hear every day, about people that are out of work, about people that are losing their homes. But it is the correct one to protect the public health. There is no doubt that the number of confirmed cases in the state will continue to increase, and that will continue throughout this month. I will let Dr. Harrist speak about that in a little more detail shortly. But at this time, I'd like to introduce Superintendent of Public Instruction, Jillian Balow, to talk about the plan going forward for K-12 schools.
Thank you, Governor Gordon. As Wyoming State Superintendent, I can say today that education in Wyoming is prepared to move forward no matter the circumstances. With the new orders, and as of yesterday, all 48 school districts have adapted learning plans for continued instruction for all students. The process to build and approve these plans was iterative and involved multiple reviews by every single school district and the Wyoming Department of Education. I have personally read every plan and communicated individually with every district superintendent in the state. I've extended maximum flexibility to school districts in addressing the needs of all students, and they can and will modify their plans as long as a closure exists. My office and I will continue to support, provide guidance, technical assistance, and more to all school districts and teachers across the state. In plans, I ask school districts to summarize their instructional approach and strategies for engaging all students through the end of the school year. There are 48 unique education plans to meet the needs of students. Learning is age appropriate, and it will not feel like normal school. My continued guidance is to prioritize personal and community health, to stay 6 feet apart, to stay home, stay healthy, and not go to the store if you have to, unless you have to. The governor's COVID-19 Task Force on Education, which I chair, has focused our work on kindergarten readiness and transitions from high school to college and career. We are also working through implications and guidance for incoming educational stabilization funds as a result of the Federal CARES Act, and we look forward to providing updates. Finally, I would like to end by saying that we have the best educators, we have the best students, we have the best communities. Let's support each other and stay safe. Thank you, Governor.
Thank you, Superintendent. We do continue to hear from residents on our border communities about an influx of out-of-state visitors seeking refuge in Wyoming. I've heard those calls. This visitation poses a threat to our communities and to our residents trying to act responsibly. I should mention that a state that is supposedly locked down, Colorado, has a number of visitors that come on a daily basis to Colorado, where a stay-at-home order is in place. Today, I am issuing a new directive that any person coming to Wyoming from another state or country for a non-work-related purpose must immediately self-quarantine for 14 days. If the individual will be here less than 14 days, I am recommending that they should self-quarantine for the length of their visit. They need to self-quarantine. This directive does not apply to work travel or Wyoming residents traveling to or from the state for work purposes. To address another area of concern around the state, we have issued guidance to grocery stores and retail stores, requesting them to monitor the number of customers in the store at any given time. This comes because of conversations that we've heard about mobs of folks at various stores around the state. We are communicating this guidance to grocery stores, and we expect them to do their best. I also want to emphasize one person per household should be shopping for groceries and essentials. Vulnerable populations should consider grocery shopping, pickup services where possible. This is not the time to be doing social visits to your favorite retail outlet or convenience store. This is especially true for kids. This approach will reduce exposed risk and is not something that can be addressed by any statewide stay-at-home order. I will consider another statewide order only at the recommendation of state health officer. We are behind the rest of the country in our progression of this disease. That is in itself a challenge. However, I will say that I believe the work that you have done, the people of Wyoming have reduced their traveling, the people of Wyoming have started to exercise the common sense we knew they would. And so I have to say that we are seeing signs that are optimistic about our work on this. And with that, I'd like to introduce Dr. Harrist to speak about the situation with regards to testing. Dr. Harrist.
Thank you, Governor Gordon. First, please allow me to follow up on the announcement we made yesterday about the Wyoming Public Health Laboratory and testing. We hope that the supply situation will improve and are trying everything we can to get more of the materials that we need. But we know that this is a problem nationwide and not just in Wyoming. In the meantime, we absolutely must ensure that we can offer timely testing for when and where it can make the most difference. That is why for now we can't accept samples from patients who do not fall within our priority categories. We need to preserve the resources we have to make sure that testing can continue. Private labs continue to be an option for providers, but we know that still everyone who may have COVID-19 will not be able to be tested. Second, we know that there are more cases in Wyoming than we have been able to directly track through lab testing, and we expect to see more illnesses in the state in the month to come. Some will be reported because they are lab tested, and some will not. If you have a fever or a cough, you might or you might not have COVID-19. We ask that you assume that you do and follow our recommendations, especially staying home and away from other people if you are ill, no matter what your job may be. Most people are able to recover at home without medical attention. If you do need help, please call a medical provider for guidance. Third, the majority of our reported cases so far can describe a likely source of infection, such as contact with a known case or travel. But there are others who can't explain when or where they were exposed. This tells us that we do have local community spread in Wyoming. As the governor has said, we need everyone to stay home as much as possible. Anyone can spread this disease, even if they don't yet realize they are ill. We want to slow and reduce the spread as much as possible to prevent illness, to avoid overloading our local healthcare providers, and of course, to save lives. Thank you, Governor Gordon.
Thank you, Dr. Harrist, and I pledge to you and the people of Wyoming that we continue to fight for every resource that we can get to battle this awful, awful, awful virus. And it's particularly difficult at this time because so many places in our country are erupting with really terrible results, and it's hard for us to get these supplies. But with that, I want to introduce Director Budd, who is going to talk about logistics and preparations that we're making statewide. Thank you. Director Budd.
Thank you, Governor. In blue skies times, we continue to plan for every situation we can think of, but of course these events never occur as expected. But it does help us adapt quickly to new situations. Those plans include the counties and local jurisdictions, so those lines of communication are open and critical connections are made. The Wyoming Department of Health has a pandemic plan, which has helped us to prepare for an event like this. While they have the lead for this event, we have pre-planning in place for how we can assist them and our communities in this event. In addition, we exercise these plans and continue to improve them. Our unified command has daily contact with the county emergency managers and public health officials to determine gaps in their response and work to help them fill those gaps. This enables them to focus their energy on immediate needs. Having an adequate supply of personal protective equipment, or PPE, masks, gowns, and gloves, is critical for the safety of our first responders and healthcare workers. We are currently in a national shortage. However, we are working to ensure those first responders and healthcare workers are protected, ultimately protecting the residents of Wyoming. As of today, April 3rd, the Wyoming Department of Health, in conjunction with the Wyoming Office of Homeland Security, has distributed 47,455 N95 masks, 83,650 surgical masks, 44,400 gloves, 3,804 face shields, and 14,635 isolation gowns. This includes supplies from the state inventory as well as the Strategic National Stockpile shipment. The state will continue to distribute supplies from the state inventory and the Strategic National Stockpile as much as possible and as supplies become available. We are in the process of receiving our third shipment from the SNS, and that will likely be the last shipment from the SNS. That will be distributed in the next coming week. We've also placed orders for PPE through the Federal Emergency Management Agency, or FEMA, with the requester being responsible for 25% of the cost share. So the SNS, there was no cost for that. Now the PPE that we're getting from FEMA or that we're able to order from suppliers directly will include a 25% cost share. We have FEMA representatives embedded in our office to assist with facilitating resource requests and communication efforts. Requests consist of PPE, medical equipment, masks, goggles, face shields, all of those, and ventilators, and testing materials, thermometers, and other medical supplies. We have partnered with the Army Corps of Engineers to identify alternate care sites in the event additional space is needed for patients who require some degree of medical care. In fact, those people are in Gillette today, taking a look at facilities there, and we'll be looking in Cheyenne and Casper next week. We're behind the scenes coordination to help lighten the load for the Department of Health. We make those needed contacts. Sometimes it's just ensuring the right players are in the room. It is so important that Wyoming residents respond to this public health crisis by staying home whenever possible and practicing proper social distancing when they must go out. We need to limit our contact with other people as much as possible and just pay attention. Make sure that we look at what the governor is telling us so we can all be healthy.
Thank you, Director Budd. A couple more points. Some of you have heard about the CARES Act, and we have been on, as a state, trying to get as much information, working closely with the Legislative Service Office, with legislators, with all departments and agencies to understand exactly what this CARES Act means. We anticipate that soon we will have guidance on how it can be, how the money can be distributed, and we are told optimistically that the 24th of April is when there may be some monies delivered. We're also working very hard. Director Cooley wanted me to remind you that we are working very diligently to make sure that we can address all the unemployment claims. There's been an overwhelming number of unemployment calls. We're trying to get more phones and more people to answer those calls. We will be patient. We will get to you. I want to add that we continue to work very closely with the federal delegation. Just got off the phone with Senator Barrasso not a few moments ago, trying to figure out how we can get more of this very critical PPE and very critical testing supplies. We also work with him and the rest of the delegation on the CARES Act. And with that, I want to thank the people of Wyoming. And I apologize for my outburst. But it seems to me that the critical thing here is how we respond, how we behave, how we as individuals act, behave, and conduct ourselves at this critical juncture. We know now that there are only 7 counties that have not had a positive, and yet every one of those counties will be affected, if not with the disease, with the demand of supplies. We are in this as a state, from one end to the other. So the headline shouldn't be governor and shelter in place. The headline is what we've told you over and over and over again. Stay at home. Practice good hygiene. Maintain that 6 feet. Practice good social distancing. Limit your trips to the store. Make sure you do everything you can to protect your fellow citizens. It could not be more critical than now. And we are seeing the effects. We're seeing the benefits. Director Reiner of the Wyoming Department of Transportation showed me statistics of the number of passenger cars that are traveling not only on our interstate highways, but also on our back roads. And that has declined precipitously. We are seeing people take this seriously. Don't let up. Let's make sure we beat this thing. God bless you. God bless Wyoming. God bless the United States of America. And thank you. We can take some questions now. Yes. Yes, Greg.
I'm curious what you thought about some state lawmakers putting out whether or not we need a special session to discuss this and the federal funding. What's your response to that?
My response is that I'm sorry. Yeah, thank you, Michael. The question was, what is my response to the question of do some lawmakers asking about a special session, what's my thought about having a special session? My thought is this: we may well have a special session, but as I mentioned, the CARES Act, the earliest we expect it to come to us is around April 24th. Currently, the Consensus Revenue Estimating Group, that group that predicts what our revenues are going to be, is looking backward. And as you remember, it seems like a year ago, but it was only about 3 weeks ago that the virus came in a huge way to the state, and before that, not much before that, to the country. So we all know that the price of oil has dropped precipitously. We all know the price of gas is on the floor. We know what's going on with coal. We know what's going on really with sales taxes, et cetera. But those data won't be really readily available until probably around May. And so an early session really doesn't make sense. I think it's probably later in May or early in June that we would look at a special session once we have more data on which to act. Thank you for that question. Next question.
Dr. Gordon, it's Barbara Ann in the Bighorn County newspaper.
Hi, Barbara Ann. Thank you.
You bet. I have a question for Dr. Harrist, please.
Okay, the question for Dr. Harrist.
Yeah.
Doctor, thank you so much for the additional statistics that you've been putting on your website. I'm kind of curious, though, and are a lot of people, which counties are having the people that are recovered, so that will show that they are actually numbers are kind of going down to a certain degree, and also how many people have to be put in ICU over this, or ones that are just staying at home.
Okay, thank you for that question. The question was about the statistics on our website. Could we show recovered by county? As of yesterday, we are showing that on the map on our website. If you hover over the county, it not only says how many cases, how many laboratory tests have been done, but also how many have recovered. So that is available. In terms of people who have more severe illness versus people who may be recovering at home, we do show the percent of patients that were hospitalized at the time of testing on our website. Other things like whether patients are in the ICU or on ventilators are more difficult for us to track. It would require providers reporting to us on a more frequent basis, which could be a burden on them, but those are absolutely things that we are looking into. But hospitalized, percent of hospitalized patients is on our website.
Great, thank you so much.
Thanks, Barbara Ann. I have a question from Wyofile. It appears the state's primary strategy is to flatten the caseload curve by encouraging people to limit contact. What's the next step in the response once and if that flattening is accomplished? How will the state know when it's time to implement that phase? Is there a particular metric or threshold that you're watching for? And I think, Dr. Harris, that's a good one for you.
Thank you, Governor Gordon. I'd first like to point out that absolutely social distancing and limiting contact with others is a very important strategy, but we are still trying to control the disease as well through methods such as contact investigations of cases, implementing isolation and quarantine. We have a team of epidemiologists who are doing that around the clock right now. So I would just like to point out that that is still an important strategy that we will continue for as long as we can. In terms of next steps, we'd have to look at the situation in its entirety. There's not just one particular measure or number that we can look at and say, okay, now it's time to start opening things back up again. We'll look at things like that not only indicate the spread of the virus, but also the status of our healthcare facilities when making that kind of decision. And we will need to be careful that reducing some of these measures won't lead to another surge of cases later on.
Thank you for that. And Dr. Harris, I think, the conversations you and I have had about how difficult it is to know exactly the right metrics. Often people say it's all bed space, but we also have to have people that can take care of those beds. And one of the reasons why we say so often that you have to practice good hygiene and we want to make sure we have appropriate PPE and how important that is because of the story that was in the Cheyenne Tribune-Eagle yesterday about the two frontline healthcare workers that have come down with COVID. And we are preciously short on our reserves of first responders and healthcare workers. Is there a question?
Governor, I know that it's put out by the Wyoming Department of Health just last November of 19, about the flu season of 2018-2019, when there were 10,000 Wyoming residents stricken by mostly the type A, but also a small percentage of type B flu. 310 of those cases were right here in Carbon County. There were 23 flu-related deaths last year. So we had 10,000 Wyoming residents with the flu last year without a collapse of the Wyoming economy on Main Street. So I'm wondering what the projection is for your modeling for how many residents might be stricken with the COVID-19 flu that we're taking these drastic measures that are having an impact on our economy. Thank you.
Sure. Thank you for the question. The question was, comparing to things like influenza, where we have some numbers on those that are published from the Wyoming Department of Health. Have we modeled to compare what the numbers for coronavirus might look like in comparison? So there are a number of models out there. We have looked at a lot of them, and we are working closely with the University of Wyoming to be able to interpret those models, understand which models may be the most accurate for Wyoming, understand their strengths and limitations, and use what we've learned from that to model, pick a good model or understand the models for Wyoming. So we are working on that. We have used sort of our flu template to make some calculations in terms of number of people sick, number of beds that we might need, number of people in the ICU. Those things all vary a lot by the assumptions that you make, including what's the attack rate of the virus, or what % of the population will get the virus, how many people will require hospitalization, et cetera. And so we have made those, and of course we can't predict an exact number. It does depend on the specifics of the virus, but we can use those in our planning, to really plan for the worst case scenario. I will say that influenza, unlike for influenza, the entire population is susceptible to COVID-19. For influenza, we have a vaccine. There are strains of influenza that circulate every year, and though they change, most of us still have some degree of immunity to influenza viruses. That is not true for COVID-19. And so the impacts of this virus, which also appears to be more severe than flu in certain populations with a potential case fatality rate that's higher than flu, that's why these very special precautions are required.
Thank you. We have Sean here.
Yeah, Sean Boyle, Wyoming. Now, Governor Gordon, I wanted to ask you, what have you seen from residents that, and I know you apologize for your outburst, but what have you seen that has grown the frustration as far as what residents are doing or not doing?
Actually, I think residents, by and large, are behaving appropriately. The importance that I wanted to emphasize is that this is a serious crisis. It is going to stretch our resources to the limit. Every individual is going to have to step up to meet this crisis. I wanted to re-emphasize that, and I wanted to make sure that our news stories talk about how important that is, and not about an order or a disagreement, because whether you talk about it as an order or whether you talk about it as an approach, the fact of the matter is, I don't think you will find a doctor who will say, you shouldn't stay home, wash your hands, maintain social distancing, go to the store on a limited basis, and don't gather in groups more than 10. So we all agree on that. And yet the stories that sometimes show are stories about disagreements between a doctor and a governor. We do agree. I invited Dr. Wheeler here, knowing full well what the Wyoming Medical Society's position was, and wanting to make sure that people understood that whether it's Dr. Wheeler, the Medical Society, anyone, we want them to stay home, wash their hands, maintain social distancing, and go to the store in a limited fashion and avoid groups of more than 10. Thank you, Sean. Next question.
Yeah, this is the news record again. I had a question for Dr. Harrist. It seems that some of the national guidelines on going with people when you do go out for necessary sessions are to wear a cloth mask. What's your thought?
Thank you for that question. The question is, the thought on the general public, the general well public, when they go out, whether they should wear masks. The guidance really up until this time has been that is not effective. I know that the White House task force is evaluating that, evaluating all the data and science around that to determine if potentially that could be a benefit to the public when they go out of their homes. And I expect that we will hear more about that, as they looked at all the data and made a scientific decision on that.
Thank you. Next question.
Sean, what
I'm just curious if you're looking at any cutback on employees at the state government level or any rollback in any salary cut to deal with the current crisis.
Thank you, Jim. I have to say all options are on the table. The question was, sorry about that. The question was, am I looking at any cuts or rollbacks in salary, cuts to staffing, rollbacks in salary? And I would say all options are on the table. I would also say, Jim, that we are evaluating how we can be more efficient in the ways we can deliver. And we are doing our very, very best to make sure that we preserve state functions and we do it within a balanced budget. Thank you, Jim. Sean, you have another question.
Yes, this question is for Superintendent Balow. If you could give me your thoughts, ma'am, on the distance learning program that was approved this week, please.
Thank you, Sean. The question was to give a little more insight on the distance learning plans. We actually have avoided using the term distance learning plans, and we call them adapted learning plans because they look different in all 48 school districts, plus charter schools, plus our BIE school in Fremont County. Superintendents and school districts had an opportunity to design those plans to meet the needs of all of their students. We did ask them to list strategies and instructional methods and plans around how they would meet the needs of learners at each age group and provide they activities. We asked for information about how special education students would be how they would ensure that special education students had an equitable education given certain special needs. We also asked questions about how they have redefined essential learnings or what's most important to learn between now and the end of the school year, and how teachers would formally or formatively or assess that in order to provide appropriate interventions and enrichments for students. Those are some examples of questions that were asked on the adapted learning plan. Again, we have 48 very unique adapted learning plans, and from Lyman to Meeteetse to Torrington to Gillette to Laramie, they all vary slightly. I will say that all of them incorporate a mix of virtual learning or distance learning, as sometimes it's called, as well as hard copy packets for some other students. They all also include a great degree of sort of a new normal interaction or engagement between students and teachers and families. The success of the adapted learning plans is truly dependent on teachers, students, and parents supporting each other and supporting students and recognizing that the plans aren't perfect, but that there are education opportunities, and that the best way for student success is to ensure that we are all supporting one another. Thanks for the question, Sean.
Governor, this is Steve Long from KOTA TV and KTBN over in Rack City with a question. And I know that the COVID-19 response is very much a state-by-state response, with every state being different. So South Dakota will be different than Wyoming. South Dakota, though, today said they expect a peak in mid to late June with lifestyle changes in place through August. Do you have any idea
So thank you for that question, which was South Dakota, from a South Dakota broadcasting station, saying that their modeling indicates they're going to peak in June, I believe you said, with lifestyle modifications probably in place to August. And how does that correspond with what Wyoming is doing? And I have to say that your governor, Kristi Noem, and I have spoken often on these very issues. We are, as you mentioned, somewhat different in the approaches we're taking. And what we're looking at is our peak coming sometime in early May. And our behaviors we will look at on a regular basis. We're hoping that by sometime in May that we can look at the metrics that Dr. Harrist spoke at and have good news for the people of Wyoming. We are, as a state, on the economic side, looking at how we come out of this lockdown more carefully with a chance to rebound. And it is interesting because, 3 of our counties that do not have a case yet and may be feeling somewhat insulated from this are the counties on the eastern border. And 2 of your counties with fairly significant amounts of COVID-19 are 2 of your most western counties. And so, again, the virus never respects boundaries. The virus can show up everywhere and anywhere. So I thank you for that question, and thank you for serving our residents in that part of the state. Yeah, a follow-up from... Well, I can probably leave that to Dr. Harrist, but I would say that anybody who feels they're safe better think again. But Dr. Harrist, go ahead.
Thank you. And the question is, what's at risk if we don't follow the stay-at-home and social distancing measures? And I don't think, it's not an unknown. It's not something that we have to guess. Anyone who watches the news can see what's happened in Italy and in other states in the United States, that our healthcare systems could be overloaded. There may be an inability for people even who don't have COVID-19 to get appropriate care. Deaths that we could have prevented that will occur. These are very serious consequences, but ones that we have a real role in being able to prevent if we follow the governor's recommendations.
Thanks. And there was another question coming on. And thank you very much for that question, by the way.
Scenarios that have been put forward. You have some in your influenza pandemic plan. Dr. Harrist, you said you looked at a number of models. You talked to the University of Wyoming, and you're talking about calculations, and you said you made those. So can you address whether you think there will be a shortage of hospital beds, ICU beds, and what the calculation for the total number of deaths might be in Wyoming?
Dr. Harrist.
Thank you. The question was, based on the calculations we've done, can we predict if there'll be a shortage of hospital beds, of ICU beds, of the total deaths? I think that, I want to be careful and responsible in putting out a number that is a number that's based on assumptions, and use these models for what they should be used for, which is, trying to prepare for the worst. But we do know that in Wyoming, Specifically, beds for critically ill patients, ICU beds, ventilators are limited. And so what I am concerned about, yes, is having enough of those specific types of beds if we have a large surge of illness among people who develop severe illness and require hospitalization.
Thank you, Angus. I see another question I think that might have come from you, Angus, which is why is Wyoming experiencing such a shortage of supplies? Is it due to population or planning? Is every state facing this issue to the same extent? Let me just take a moment before I give that question to Director Budd and be very honest about this. Whether it's Montana, whether it's Colorado, whether it's Idaho, whether it's Utah, whether it's New York apparently, whether it's Illinois, whether it's South Dakota, or whether it's Wyoming, every state at this point is finding that the federal government is stepping in and canceling our orders for PPE. It is very frustrating, extremely frustrating, when we have orders that are supposed to be on their way and we find that FEMA, the agency that's supposed to help us, has preempted that order. And a lot of those orders are being distributed to the east, where the hot spots are, and we don't deny that those are important. New York, Louisiana, Baltimore, places like that. We understand. But as I said to President Trump, not at the beginning of this week, when you're doing this, Mr. President, please remember that you have the opportunity to be able to deliver some of that to Wyoming, to Montana, to North and South Dakota, so that we can get ahead of this and we aren't playing catch-up like the rest of the country. But with that, Director Budd, please go ahead.
Thank you, Governor Gordon. We are following the governor's lead in being very concerned about the federal government preempting orders to Wyoming. We've seen it at the state level as well as the county level. It's disturbing. We're doing everything we can to come up with innovative solutions, including ordering directly from China. So we're working very hard to try to find a way to get more supplies to Wyoming. And as the governor said, it's not just Wyoming. It's across the nation, and we have to figure out how we can get first in line.
Is there another question?
Yes, Governor.
Oh. Yes, Andrew. Andrew, I'm not sure exactly what's happening, but I'm having trouble understanding your question. Michael, did you hear it? Okay, so the question, Andrew, if I understood Michael's translation, sorry, he's closer to the speaker, was are there other indicators that are showing that people are starting to respond to the stay-at-home, practice good hygiene, shelter in, with small groups, all of those kinds of things. Was that the question?
Yeah, especially when you see the case numbers in Wyoming doubling this week and last week as well, and no sign of that tapering off that I can know.
Sure. So I'm going to let Dr. Harrist talk about the doubling, but if you'll remember, two years ago, and again the question was, what are the indicators we're seeing, and how do we reconcile that with testing numbers indicating more positives? If you'll remember, 2 weeks ago I said we were providing more tests, and we would see not only more positives, but we'd see more tests. And Dr. Harris can speak a little bit to that. But what I would say as far as the other metrics we're seeing, a lot of it's anecdotal. We're not hearing as much about mobs storming Walmarts in Natrona County, in Cheyenne, and in Sheridan. And the one that was supposedly happening in Cody apparently was debunked. We're hearing from others that people are getting it and they're stopping behaving the way they were. We still see some groups gathered around basketball hoops and things like that, and we want to make sure that those groups stay small. Anecdotally, we're hearing that there's tremendous crowds at the top of Teton Pass. We'd like to discourage that, and that, again, that was one of the exemptions in the Teton order. But as you look across the state, I think people are beginning to respond, and I think you see that in the data that is about car traffic, and I think you see that in the parking lots in front of some of these stores. Dr. Harrist, would you like to address the testing?
Thank you. Yes, and as I said on Monday, there's certainly an increased number of cases because there's an increased disease, but there's also an increased number of tests being conducted. It's not surprising that we're continuing to see cases increase, and we do need to take that very seriously. We're of course in a position where we can't know what the case count would be like if we hadn't put those measures into place, and I'm glad that that's not something that we have to know, because I think those measures are very important and necessary for public health. And then just also remembering that these measures are meant to slow, not completely stop the spread of this disease, and to slow the disease in order to not overburden our healthcare systems and to save lives.
There is some evidence for Jillian at the county level, counties with stay-at-home orders see less movement than those of Balow. There tends to be the idea that present order brings clarity to businesses, to people who aren't sure whether they should be going out to do one thing or another. And I just wonder if you could elaborate more on why you don't see the difference between issues and order and not.
So, wow, sorry about that, Joe. Andrew, I think your question was to look at, if I understood you correctly, the issue about a disagreement over issuing an order, and following that with places that have had county orders. If I understood, you said county, but places that had county orders that it does limit the traffic somewhat. And people tend to move less. That might be true. I don't know. It depends on the data that are there. But if I were to look at where my daughter lives in Brooklyn, and I were to look at Crook County, Wyoming, I would see very different demographics that would also indicate there'd be some differences in how that statistical model would work. My point is, and has been, that people don't need to have somebody tell them to put a raincoat on when it's going to rain. And believe me, it is raining. And you hear Dr. Wheeler, and as I said, we don't have a disagreement. We both think that you need to stay home, wash your hands, maintain social distancing, limit your trips to the store and your gatherings to less than 10. That's the behavior that's critical here. And what's essential about that is, and Andrew, you may not have been able to see it, but I brought with me several of the orders, and the one paragraph that would say something like shelter in place would then have multiple pages of exemptions for lots of good reasons. There's no question. But suddenly now the argument is, well, we've got a shelter-in-place order, but how can I get around that? How can I get an essential designation? And we're trying to keep this very simple. Talk less, say more. When I drove down Yellowstone today, what I found is that there was only one store that would have been closed under the Colorado order, the florist. So my point here is that people need to focus on staying at home, washing their hands, maintaining social distancing, and limiting their groups to 10 and their trips to the store. That's the story. That's what we need to do, Andrew. It's not an argument between Dr. Wheeler, who I respect and think the world of, or between Dr. Dowell and me. And in fact, what we have always maintained is if a county in Wyoming and their county health officer wants to step up their order, we will work with them, as we did with Teton. Thank you. Next question?
Governor, why don't we move now?
Go ahead.
Okay,
Hey, Sean.
now, Sean Boyd, is there any, speaking of rebounding, is there any plans for closing the state office for the foreseeable future?
Sean, good question. What we have done is and the question, thank you. The question was, is there any plan for closing the state office buildings? And what we recommended and what we have ordered is that where people can telecommute, they should. Some offices are closed but have a computer terminal so that there's access, understanding not everybody has access to a telephone or a computer. We have provided numbers. Lynn, you've probably handled a bunch of this. Director Budd, why don't you go ahead and walk through that? Sorry, Sean.
Yes, thanks. We are looking at all the numbers, and I believe, and I didn't bring those figures with me, but I believe that over 50% of the agencies have 75% of their workforce working from home. So the agencies are doing a fantastic job of getting their people at home or separating them within their offices and making sure that they have that proper social distancing. So they're doing a great job.
And Sean, if I could just follow up on that a little bit. I also want to thank the superintendent for the amazing work that her group has done. As people probably know, not every district is the same in terms of its resources. And so, Superintendent, would you like to speak to a little bit of the variation around the state and how people are meeting those challenges?
Thank you, Governor. Yes, we have several communities across the state who are shelter in place at a local level. So at the Department of Education, we're providing very individualized and tiered support to those districts. Obviously, they meet the needs of students very differently than some of the other districts that maybe don't have any COVID cases yet. But our guidance is very clear, and that is to put the health of yourself, your family, and the community first and foremost. Education is important, but it's not as important as life and the life of your community. And so with that priority in place, with the governor's guidance to stay home, wash your hands, practice social distancing, don't gather in groups larger than 10, and limit your visits to the store. All 48 school districts have had to work around that guidance, work within the parameters of the guidance provided in their community to meet the needs of learners. You know, I think it is going to continue to be a challenge to engage students who are at risk or who are not engaged in what we would consider a normal school. So we have asked all educators to step up and make their first priority with respect to learning opportunities, connecting with students, connecting with families. We continue to provide guidance to school districts. Just as recent as today, our task force on education, the governor's COVID-19 task force on education, had a conversation about you know, just making sure that we're connecting with students to ensure their safety. After this press conference, we'll be ready to push out, again, on social media, the safetotell.org information where students can call if they feel like they want to hurt themselves or know of someone who wants to hurt them or others. We also will provide information on where they can find food. Again, if we're talking about needs of people, needs of schools, needs of communities, we need to put basic needs first, and health is one of those. Health and safety are both basic needs, and education is secondary. Communicating and connecting with students is so vitally important during this time. Thank you, Governor.
Thank you, Superintendent, and let me just follow up. I mean, one of the great worries we have at this time is seniors being at home. The First Lady and I have recommended that people draw cards, write a message. We'll send them to the governor's residence. We'll make sure they are delivered in a safe way to seniors that are unable to get out. I also want to say that this is a time, a very precious time, when we worry a lot about our kids. We worry a lot about domestic abuse. These are terrible things, and at this time, they are big concerns, health concerns for the state as well. With that, I think we have maybe one more question. So thanks, Jim. I'll let Dr. Harris take this in a second, but knowing your question about modeling and getting better data and understanding the predictions and wanting to get to the bottom of the numbers, I know you live in a place where weather reports are incredibly important, and so you understand predictions probably better than most. Dr. Harrist.
Thank you. So the question was for some specific numbers on, best case scenario of cases and worst case scenario of number of cases. And I don't have those with me. I'll just say that right now. But I think, more important from a public health and prevention standpoint is actually what you asked about before. A number of cases doesn't mean as much as the consequences that could result from that. So are we not going to have enough hospital beds? Are we not going to have enough ICU beds? Are we not going to have enough ventilators? Are we not going to have enough healthcare workers to take care of the patients in those beds and on those ventilators? And my answer stands as before, that yes, I am concerned if you look at a worst case scenario that we will not have enough ICU beds, ventilators, healthcare workers to take care of patients. And that's why we're asking people to take the measures that we're asking them to take.
And with that, I want to thank you all for tuning in, for paying attention, and most importantly, for communicating. This is the worst crisis I hope we ever face in our lifetimes. I expect it will be the worst. Certainly the worst that I've seen so far. It's across the spectrum, from sickness to economic health, to people's recovery, to the state's future. All of these things are big issues. And we'll face them together. And I do know, working together, we can face down this terrible thing. And I do believe we can build a better state. God bless you. Thanks.